study of vaccinated healthcare workers has found that both vaccines produce a high immune response, up to 95% in the recipients, and prevent serious disease in those infected after immunization. The study included 515 vaccinated healthcare workers. Interestingly, the vaccine Covishield could generate more antibodies in more individuals compared with Biotech's Covaxin. Well, to talk more about this, we're joined by Dr. AK Singh, a senior consultant endocrinologist, GD Hospital and Diabetes Institute, Kolkata, and one of the authors of this study. Thank you so much, Doctor, for joining us. Tell us more about this study. What was the period, and it's the first such study in India?
Well, thank you, Gargi, for having me in this show. So actually, we planned this study somewhere when the vaccination started on the very first day, on 16th of January 2021. Because, you know, in the past, we have done studies in our patient. It was a good opportunity to do a study on ourselves. So, you know, a group of doctors across the country had a Zoom meeting, and we decided to conduct a, you know, humoral body antibody response after 2 doses of vaccines. So we selected initially 552 participants across 13 states involving 22 cities. And, you know, we did the first test 21 days after the first shot. And we also did the second test 21 days after the 2 completed dose of each Covishield and Covaxin. So what we found, you know, after the completion of 2 doses of both vaccines, that both vaccines showed a very good positive seropositivity rate. That means in 95 out of 100 participants, the humoral antibody response was positive. Okay, so, so that's the first part of the story. So interestingly, when we further looked into the data, we interestingly find that although both, you know, vaccine induced good immunity, somehow the Covishield recipient had, you know, little more robust mean titer of antibody, and also a certain percentage of people receiving Covishield had higher seropositivity rate compared to the Covaxin. So although we did not target to compare Covishield and Covaxin directly, but this was the incidental finding in our study.
Right, Doctor. So also tell us about your findings regarding breakthrough cases. You know, that's getting the COVID infection after being fully vaccinated. What did your studies find? Because these were all doctors and healthcare workers who were working in, you know, hospitals with COVID patients.
True. Well, so, you know, because this study is still on, this is a longitudinal studies for, you know, next 6 months after the second complete dose. So we will final log the data after the completion of 6 months from the second dose. However, when we did an interim analysis after the second dose, we could find that, you know, there was on average 5% of the people had breakthrough infection. What was interesting to note that these infections were mild to moderate. In 95% people, it was mild, so it was just a mild fever for a couple of days, and it did not require any intervention except a tablet of paracetamol. In 5% of people, it was moderate. Moderate means this fever persisted for, you know, fewer days, up to weeks, but then no one required hospitalization, no one required oxygen supplementation, and no one required mechanical ventilation. So that's the, you know, one of the great finding of having a fully vaccinated with 2 vaccines.
Right. And Dr. Singh, what else did you find in terms of, you know, the impact on men, women, those who are older, those who are younger? Any more interesting findings regarding that?
Well, so this was a study that planned to correlate, you know, the antibody response with gender, with body weight, with different blood group, with, you know, associated comorbidities. Although we did not find, you know, any difference in having a seropositivity or a difference in mean titer, with regard to age, sex, BMI, blood group, and comorbidities. But what we could notice that people who were older, more than 60 years of age, and someone who had diabetes had little lesser seropositivity and median, titer of antibody. What was also interesting to note that female had, higher median titer of, anti-spike antibody compared to male. Even many studies which has been done with other vaccines like Pfizer and Moderna in US and UK, they have consistently shown that female produces little more antibody titer compared to males. And exactly it was replicated in our, first real world study from India.
All right, so that's a very interesting aspect of this study, which is still in preprint. You're waiting, for more peer review of this study. Also, tell us about those who were earlier infected with COVID and then received the vaccine. What were your findings regarding that?
Well, so that was an interesting finding. Although the one sort of injection did not yield a great seropositivity or antibody titer, in contrast to the two complete dose of vaccines in someone who didn't have past history of COVID-19. However, in people who had history of COVID-19, even a single shot of any one of the vaccine yielded a almost 100% seropositivity rate and highest median titer of antibody. So this suggests that perhaps one dose of any of the vaccine in people who had a past history of COVID-19 may be adequate. And I would suggest, during the deficiency or shortage of vaccine across India, the people who had a history of COVID-19 should get one vaccine and wait for a little longer period of time. Let's vaccinate the SARS-CoV-2 people who have not been infected with COVID-19 in the past. They should be given the priority.
All right, Dr. Singh, that's interesting for me because I had COVID and I've had one dose of the vaccine. And finally, I want to ask you, this is, as we mentioned earlier, the first such study in India, and this comes at a time when we're still waiting for Bharat Biotech to release its data. Your comments about that?
Well, so we were excited to present this data to all of us because we all were waiting for phase 3 data of Covaxin for such a longer period of time. Many people took Covaxin without knowing how actually it works. So it was a good timing for this study to show that Covaxin also yielded 80% seropositivity rate in our cohort of 515. So that was one reassuring evidence to suggest that Covaxin also works well after the 2 complete doses.
Absolutely. Thank you so much, Dr. AK Singh, for taking time out and joining us this morning.
My pleasure. Thank you, Gar.
Thank you.